Um, and as you note now, its recording is in progress. I hope that's okay. So this is the third webinar in our climate series, and this one's about climate change and human health. And so welcome everybody. And first of all, I just wanted to acknowledge that we're on the lands of the Gimoy, Wallabarri, Yidinji and Yirrkala lands where I am today. That's unceded land. And to acknowledge all the traditional custodians of the wet tropics region where we work, and pay my respects to the elders past, present and future. So today we have Dr. Nicole Sleeman, who's a Cairns-based GP, who's going to give us this talk, and some of you have already heard her giving a consultation. She's an active member of Doctors for the Environment Australia, and is passionate about raising awareness of the link between climate change, planetary ecosystems and human health. I'm sure she can tell you more about that herself. And she does this through education, advocacy and campaigning for urgent climate action. So how we run these webinars is we do a Q&A at the end, and it'd be really great if you put your questions into the chat as we're getting closer to the end of the talk. And we will have another webinar in July that'll be focused on community power opportunities for North Queensland. So we'll let you know more about that one if you stay connected to us. And if you wanted to, the previous webinars and this one will be uploaded to our YouTube channel, and you can find it if you go to our website, which is terrain.org.au, to the climate page, and then you'll find a link to the YouTube channel. I'll stop talking now and let Nicole get underway. Thanks everyone.
Cool. So hi everyone. Thank you for the intro, Sarah. So just go to the second slide, please. So first up, I'd like to acknowledge the Gimoy, Wallabarri, Yidinji and Yirrkala people, who are the traditional custodians of the land on which I work and live. And I'd like to acknowledge the strength and knowledge that Aboriginal and Torres Strait Islander people bring to our community, and to pay respects to their elders, past, present and emerging. All right, next. Oh, sorry, Monica, next.
It's just a bit of a...
Sorry.
Should be happening any minute.
Cool. So just a quick intro. So as Sarah's already said, so I'm a general practitioner here in Cairns, and I work part-time as a GP, and I spend the other part of my week volunteering in the climate health space. As Sarah mentioned, campaigning, advocating and educating on the health impacts of climate change, and for the need for urgent climate action for the sake of human health, as I'm about to do here today. So I joined the climate health movement in 2017, and at that time I was living in Sydney, and I was doing a lot of swimming in the ocean, and I became really upset about the amount of plastic pollution that I was seeing. And so I was doing some Googling and speaking to colleagues, and I found out about the organisation called Doctors for the Environment Australia, and I went along to their annual conference, and actually didn't learn anything about plastic on that weekend, but I very quickly came to understand the gravity of climate change and all of its health impacts. And I left that weekend both anxious and also inspired. And I joined the climate health movement immediately, and I've been doing this work ever since, alongside many other health professionals here in Australia and internationally. Next. So 12 years ago, in 2009, the international medical journal, The Lancet, wrote that climate change is the biggest global health threat of the 21st century, and that the impacts will be felt all around the world, and not just in some distant future, but in our lifetimes and those of our children. Next. So underpinning this is an understanding of what has been coined the term now planetary health. And planetary health is about getting that humans are not separate from the planetary ecosystems within which we live and upon which we depend for our very existence, and that the health of these ecosystems ultimately affect our health. And this notion is something that Indigenous people have known forever. So a very basic list of what we can refer to as the ecological determinants of health is, next, adequate amounts of fresh uncontaminated water. We need adequate oxygen from unpolluted air. We need abundant fertile soil for food production and nutrients, a stable climate with temperatures conducive to sustaining life, an ozone layer which protects us from harmful levels of UV radiation, and we need access to nature and green space. Next. So today the focus is on climate, and this is really only a brief introduction because it's a huge topic in itself. So this infographic summarises the main health impacts of climate change, which, as you can see, there are many. And one important concept to understand is that climate change doesn't invent new diseases as such, but it exacerbates existing health issues and inequities. And those that have contributed the least to the problem are the most affected. So really, climate change and health is also an issue of justice. So as you can see here, the infographic divides health impacts into underlying ecological causes, being rising temperatures, increases in frequency and severity of extreme weather events, rising sea levels, and increasing carbon dioxide levels. Next. So the IPCC report, which I'm assuming everybody here has heard of, the Intergovernmental Panel on Climate Change, was released earlier this year in February, and part of it looked at the health impacts of climate change in our region. So with permission, I'm borrowing some slides from Dr. Nina Lansbury, who is a senior lecturer at the School of Public Health in the University of Queensland, as she was one of the lead authors on the health section of the report. Next. So chapter 7 of the IPCC report was focused on health and well-being, and it covered all the points. Oh, sorry, can you go forward, Monica? Sorry. So chapter 7 focused on health and well-being. It covered all the points here, so including the projected risks to health and well-being under alternative scenarios, vulnerable populations and communities, and psychological, social, and cultural dimensions of health. Next. So the report divided health impacts into 3 broad categories: direct health impacts, which are those from extreme weather events such as floods, storms, and cyclones. And these are expected to increase in frequency and severity with climate change. Into indirect health impacts mediated by changes to natural systems, so including the quality of and access to drinking water, air quality, food safety and security, and infectious diseases, for example, mosquito-borne diseases. And the indirect health impacts mediated by social systems, which are the social and emotional well-being impacts and impacts from housing infrastructure. Okay, next. So I'm just going to go through some of the impacts that are outlined specifically for Queensland. So heat is one, and I'll touch on this in further presentations, but heat increases deaths as well as heat-related illness presentations to health services. Next. Bushfires that cause both direct and indirect deaths. So there are deaths that occur directly from the bushfires, and then there are deaths that occur from heat-related illness or from respiratory illnesses or heart attacks secondary to smoke pollution. So for example, in the 2019-2020 bushfires, there were 33 direct deaths from the fires, and indirectly there were 417 deaths. There were 3,151 hospital admissions for heart and lung conditions, and about 1,300 emergency department presentations for asthma. So we only got the direct deaths in the media, but actually things like bushfires have extensive health impacts, both for individuals, communities, and on health services. Next. So mosquitoes carry climate-sensitive infectious diseases. So a good example is dengue fever, which remains a threat here in Northern Australia, and variations in rainfall and temperature are related to disease outbreaks and patterns of spread. So areas of Australia suitable for transmission of dengue is projected to increase. And next. Water contamination. So in heat, water can be contaminated by bacterial growth, as it can during droughts. You get changes to water. Respiratory, so thunderstorm asthma is a really good example. In 2016, Melbourne suffered the worst episode of thunderstorm asthma ever recorded worldwide, and emergency services were overwhelmed, and there were 10 deaths during thunderstorm asthma in 2016. And so up here in Far North Queensland, with big storms and cyclones expected to increase, these can trigger exacerbations of respiratory illnesses such as asthma. Next. So people with existing health conditions and socioeconomic conditions are most vulnerable to the impacts of climate change, which speaks to the fact that people who have contributed least to the problem who are often most impacted. Next. So we have many health system challenges in the face of climate change, because both as a sector, we're a significant source of carbon emissions, so we need to decarbonise, and Also, our current lack of capacity to deal with climate impacts, such as in the midst of, a thunderstorm asthma or heat waves. And also health systems can be damaged by climate change. For example, Cairns Base Hospital, which sits in a flood zone and will ultimately be covered by seawater as ocean levels rise. All right, next.
Is that showing the right one, Nicole?
It is, it just doesn't have the picture for some reason, but I don't know why that is. That's okay. Oh, there you go, there it is. So Torres Strait Island communities are already feeling the impacts of climate change from sea level rises in particular. And these impacts are exacerbated by baseline health of individuals and communities, overcrowding in housing, remoteness, and the trauma from both historical and continuing colonisation. And next. So the work behind these two papers contributed to both the IPCC report and the Luicha report launched at COP26. And they evidence that remote Indigenous communities are particularly vulnerable to climate impacts. Specifically, with regards to climate-sensitive infectious diseases, the Torres Strait Islands have been shown to carry a disproportionate burden of ongoing risk, as changing weather patterns associated with climate change are shifting the geographic range, seasonality, and the intensity of transmission of selected climate-sensitive infectious diseases. And so this paper looked at 5 different climate-sensitive infectious diseases and showed that one of them, for example, melioidosis, the Torres Strait Islanders have 20% of all the cases in Queensland. And I think it's, I can't remember the percentage of the population of Queensland, but it's tiny, but carries 20% of total cases, which is huge and expected to increase. All right, next. So the Luicha Institute report on climate and health in First Nations people has these key findings, which are that impacts from climate change will vary considerably across Australia. There are many varied direct and indirect climate change impacts on the morbidity and mortality of Aboriginal and Torres Strait Islander people, that they will only compound historical injustices and disruption to cultural and spiritual connections to country that are central to health and wellbeing, that health service will struggle operating in extreme weather, and that climate change presents an opportunity for redress and empowerment. Next. So I want to cover a little bit about heat, as this is one of Australia's biggest health challenges in the face of the climate crisis. So heat waves have been a public health issue for a long time, and heat deaths have been absolutely totally underreported in Australia. Heat has actually caused more deaths in Australia than all other natural disasters combined. Next. So this is a hockey stick graph, and it's a consistent pattern that's seen in temperate climate cities across the world. And what it essentially shows is that wherever you are in the world, deaths take a sharp upward curve at a particular temperature, which goes beyond whatever is considered to be the comfort zone for that geographical location. So here in Far North Queensland, our comfort zone would be hotter than the comfort zone of Tasmania, but both Far North Queensland and Tasmania will see an increase in deaths as we exceed our respective zones. And so this epitomises the ecological determinant of health, that humans really need a stable climate to survive and flourish. Next. So in the period of 2006 to 2017, there were actually more than 36,000 deaths in Australia due to extreme heat. Next. And official records have underestimated heatwave deaths at least 50-fold. And next, under a best, and under a best case scenario, which is a low carbon emission scenario, we can expect a 200% increase in heat related deaths in Australian cities. So where best case scenario, low carbon emissions, we're still going to see double the number of deaths of people due to heat waves in Australian cities. Under a high emission scenario, we can expect a 400% increase in deaths, so 4 times what we already have. Next. So here in Cairns, we experienced record temperatures in March earlier this year, which exemplified the impacts on health and health services. This is from the Cairns Post. And next. And so as you can see, heat is core health business. So during heat waves, we see increased ambulance call outs, increased hospital admissions, outbreaks of foodborne illness, cardiovascular disease, and decreased mental well-being. Next. And specifically in relation to mental health, increasing temperatures result in increased rates of suicide. There's exacerbations of bipolar disorder and schizophrenia symptoms, and increased hospital presentations and admissions for these. People with dementia have exacerbation of their symptoms. There's an increase in feelings of distress, just widespread, and increases in intimate partner violence too. Next. So as a GP on the front line, I saw several presentations of heat-related illness in our March heatwave, including actually 2 patients who were otherwise fit, fairly young, healthy, regular patients who both ended up in the emergency department with heat-related illness. And these are just a couple of posters that the Royal College of General Practitioners has put out in their Climate Health poster series, which is available for all health services to put in their waiting rooms to raise awareness of some of the health impacts of climate change. Next. So we're all at risk of heat-related illness. However, certain groups are at higher risk. And so some of these are individuals with chronic disease, especially heart disease, respiratory disease, kidney disease and diabetes. And actually studies consistently show that adults older than 65 years, especially those with heart and lung or other chronic diseases, and very young children are particularly vulnerable to the effects of heat, irrespective of where they live or their income level. Women who are pregnant are at higher risk due to body changes in pregnancy. And actually one study looked at windows of exposure to heat and found the relationship between preterm birth and heatwave exposure in all months of pregnancy. And here in the far north, heat poses immense risks to First Nations communities, given the high prevalence of chronic disease, coupled often with substandard housing conditions. Next. So just a bit about air pollution. Air pollution is the most direct link between the drivers of climate change and of poor health, because burning fossil fuels, especially coal, is the main source of carbon emissions, which is driving climate change. And it's also the main source of air pollution. And actually a recent study by Harvard University showed that burning fossil fuels is responsible for greater than 8 million deaths per year worldwide, which equates to nearly 1 in 5 deaths globally due to fossil fuels. Next. So the 2 main air pollutants that we look at in relation to health and climate is particulate matter, known as ppm, and this comes largely from burning fossil fuels and from bushfires. And fine particles, especially ppm 2.5, can remain in the atmosphere for days to weeks and travel very long distances, influencing the air quality of regions far from the original source of emission. So in 2020, during the bushfires down south, people in South America felt the effects of the Australian wildfires in their skies when they turned hazy due to smoke all the way over in South America. And then the second common pollutant is ground level ozone, which is a colourless gas, and it's highest on summer afternoons, which is most afternoons up here in Far North Queensland. Next. So ground level ozone is a secondary pollutant, and it forms when pollutants emitted by motor vehicles and industry react in the presence of heat and sunlight. And so ozone is a major constituent in the upper regions of the atmosphere, but when it's down here on the ground, it's harmful for humans, and it affects even healthy lungs, causing inflammation, reduces lung function, and causes respiratory symptoms. And so exposure to ozone is linked to increases in deaths, increases in hospital admissions and emergency department attendances, mainly for lung issues, and asthmatics are particularly vulnerable as ozone can trigger asthma symptoms. Next. So air pollution and heat make each other worse. So it's a positive feedback cycle. Greenhouse gas is our main source of air pollutants, and it's driving global warming, which then increases pollutants further. Importantly, ground level ozone. So this graph shows data of increased parts per billion of ground level ozone as temperatures increase. And there's another graph which shows hospital admissions, as well as both ground level ozone goes up and temperature increases. Next. So most Australians would think that our air is clean, but actually almost 5,000 Australians die from exposure to air pollution every year, and thousands suffer health effects such as strokes, heart disease and asthma. And Australia's current national air pollution limit actually exceeds the World Health Organization recommendation thresholds. So you don't need to be able to see dirty air for it to be polluted enough to be harming your health and the health of your families and community. Next. We will see more floods up here in Far North Queensland, which have extensive health impacts that, obviously people are experiencing a bit further south at the moment. And so impacts are both immediate, medium term and long term from these extreme weather events. And unique to us up here is risks from crocs. So this crocodile made it to the Bruce Highway during flooding events between Cairns and Townsville in 2019. So let's shift now. We've gone a little bit over the health impacts. So shift our focus to look at what we can do to protect human health in the face of the climate crisis. Next. So mitigation and adaptation form the basis of the needed response from climate change in all sectors, really. The health effects of climate change are already happening, they're going to get worse, and we need to be prepared and to adapt in order to cope both as a health sector with the current and future climate impacts and, as society. Next. Ultimately, we need political action, and there is perhaps some hope now given the recent federal election. However, Labor's climate policy is still not in line with the science, which tells us that we need to cut greenhouse gas emissions by 75% by 2030. So our work is not done in pushing our new government to develop and implement climate policy, which is in line with the science to protect human health. Next. And so in 2021, fossil fuel companies backing large gas projects across the country gave nearly $1 million in political donations to our three major political parties, Labor, Liberal and the Nationals. And so we cannot effectively respond to the climate crisis without addressing the unjust influence of big profit-driven corporations on public policy. Next. As mentioned in my intro, I volunteer with Doctors for the Environment Australia, and we're a not-for-profit organisation of medical professionals that educate on the link between climate change, planetary health and human health, and advocate for urgent action on climate change to protect human health. Next. And so we were actively campaigning in several electorates in the lead up to the federal election, and our policy asks are listed here, and they reflect our health expertise and climate science. So our first policy ask is around adopting an ambitious national plan to cut climate pollution this decade to protect health with strong science-based targets that at a minimum match our key allies and trading partners. And this plan should include banning new coal, gas and oil projects and ending public funding to fossil fuels, should include the accelerating the transition to electric vehicles and the delivery of 100% renewable electricity by 2030. The second ask is that we are supported to establish a national sustainable healthcare unit to support environmentally sustainable practice in healthcare and reduce our own carbon emissions, because the Australian healthcare sector emits 7% of Australia's total carbon emissions. And so we have a lot of work to do ourselves to reduce our harm that we are causing Australians through our significant contributions. The third ask is to develop a national climate change and health strategy to protect and maintain the health of all Australians by risk assessment, mitigation, adaptation planning for climate disruption and climate emergencies at all levels of government, and to make all levels of the healthcare sector, both federal, state and community-based, more resilient through climate disaster infrastructure and workforce planning. And lastly, to protect and restore nature through the urgent reform of Australia's environmental protection laws and by ensuring Australia's commitments under the Global Biodiversity Framework. Next. So regarding our third ask, the National Climate and Health Strategy, the not-for-profit Climate and Health Alliance published a policy framework in 2017, which proposes just this. And so CAHA, Climate and Health Alliance, is another not-for-profit organisation that's a coalition of healthcare stakeholders, including many organisations representing health professionals across the spectrum, research and academic institutions and health consumers. And they released a document last year, the Healthy, Regenerative and Just Policy Agenda. And this had input from 100+ experts across different fields. And it looks at how we can prioritise planetary health, the protection of ecosystems and earth systems, along with a culture of cooperation for collective benefit. Next. So their policy framework for a national strategy on climate health and wellbeing for Australia includes recommendations under these 8 areas of policy action. So supporting healthy and resilient communities, health promoting and emission reducing initiatives, emergency and disaster preparedness, education and capacity building, leadership and governance, research and knowledge, a sustainable and climate resilient health sector, and thriving ecosystems. Next. So as I mentioned, the Australian health sector is 7% of Australia's total carbon emissions, which is actually huge when you think about the fact that we're a sector based on first do no harm, and actually we're causing a lot of harm with how much carbon we emit. And there's also a great opportunity to reduce Australia's total emissions by decarbonising healthcare because we have so much. So what does sustainable healthcare look like? So this is from the Centre for Sustainable Healthcare in the UK, and there are 4 areas within which to act. So prevention, patient self-care, lean service delivery, and low carbon alternatives. And so this is all based on the idea that we emit carbon just by practicing healthcare in general. And then also, I guess the more healthcare we practice, the more carbon we emit. So we need to also we have like carbon intensive therapies that we currently kind of practice within. Next. So the greenest healthcare system, sorry, go back. The greenest healthcare system is one in which people don't get sick enough in the first place to ever need medication, because medication has a huge carbon environmental footprint, or hospital admission, which has the most intensive carbon footprint. And so again, this highlights the core role of public policy to create healthy, equitable societies that support health. And so preventative care is not just the realm for GPs and primary healthcare, it's for all of us. It's for governments who make those public policies. For example, air pollution from burning fossil fuels that ensues each time governments give the go-ahead for the opening of a new coal mine or gas project. And it's also the realm of local governments, town planners, public health units, and even organisations like all of you are from today. Next. So socioeconomic inequality is an overwhelming risk factor for ill health. And so if we want to reduce the carbon footprint of healthcare and society at large and support human health and thriving communities, then we need to address inequalities in our society, including things such as class divides, structural racism, and access to education, just to name a few. Next. In terms of low carbon alternatives. So physical activity is a low cost, low carbon, effective treatment for many diseases. And it's also an example of a co-benefit of climate action, which essentially means that it's something which is good for both our planet and for us. So for example, riding a bike or another form of active transport to reduce motor vehicle emissions helps to mitigate climate change. It benefits health, and being healthy reduces healthcare's carbon footprint because there's less carbon emitting health interventions. So it's a positive feedback loop. Next. So food is the single strongest lever to optimize human health and environmental sustainability on the planet. However, food is currently threatening both people and the planet, accounting for 26% of global greenhouse gas emissions. And so to solve this, the Eat Lancet Commission convened 37 leading scientists from 16 countries to work out how we could feed a future population of 10 billion people with a healthy diet which optimizes human health and is within the finite bounds of the Earth's resources. And in 2019, the summary report was published. And next. And so it concluded that diets high in plant-based foods with reduced animal products confer both improved health and environmental benefits. And the recommendations include a universal planetary health diet, which is represented by the graphic here. And the Commission does not specifically promote a vegan or vegetarian diet, but they instead describe an omnivorous diet or a flexitarian diet characterized by a high plant-based content and optional low amounts of animal source foods. And these recommendations align with dietary guidelines. And I guess of interest, in 2017, the Lancet Medical Journal stated that nearly 990,000 deaths were due to excess red meat consumption. And so this indicates that cutting down or giving up red meat is not only good for the planet, but it's good for your health. We go to the next slide. Just to illustrate the impact of food choices on climate is this graph from Our World in Data. So beef up the top far outdoes any other food choice in terms of carbon emissions. And so I've personally done some study in plant-based nutrition, and I encourage patients daily, if not to remove their animal products from their diets, then to reduce them dramatically to support both their health and as a wonderful individual action that you can take to reduce your carbon footprint. Next. So there's increasing interest in measuring air pollution, and Aerator is an app that's been developed that records air quality data so that you can know what's happening in your area. The Aerator app has also been endorsed by Asthma Australia, so it's a really good tool for everyone. It's not collecting data everywhere though, so it's only useful if you're in one of the measuring zones. And this, something like this could be like initiatives of local councils. We'll go to the next slide. So in New South Wales, for example, the Environmental Protection Agency runs about 30 industry-grade monitoring sites with real-time data online. I don't think, to my knowledge, this doesn't exist in Far North Queensland, but it's absolutely something that would be implemented. Next. So urban green space is really beneficial to human health and for building healthy, resilient communities in the face of climate change. As you can see here, so it improves air quality, reduces noise, enhances biodiversity, it moderates temperatures during hot periods and provides cool and shaded areas. Physical exercise and social interactions, happen in green space. It's great for relaxation and mental restoration. And actually it reduces illness and death from chronic diseases. It improves mental health and pregnancy outcomes, and it also reduces obesity. Next. And so involving local communities in the design and management of green space has been found to foster a sense of ownership and promote use. So again, coming from the ground up, we want to support communities to be in charge of their health and to reconnect to nature. Next. And this is just a nice little infographic, which tells us why green space is good, essentially. Next. So the third principle of sustainable healthcare is lean service delivery. And we have so many resources in Australia and we overuse them to the detriment both of to our health and to the health of the planet. And so lean service delivery is about minimizing wasteful activities within healthcare. Because actually all health activities have a carbon footprint, including if you go get a blood test, that has a carbon footprint. If you go get a CT scan or an MRI, they're very carbon intensive. And not all of these investigations actually make measurable outcomes to the patient, either individually or on a population level. Next. Actually, telehealth saves a huge amount of carbon. So in 2017-18, so telehealth obviously came in with COVID, but in 2017 to 18, the Royal Children's Hospital in Melbourne saved 57.6 tonnes of carbon dioxide, and there were no patient safety issues observed, and patient feedback was universally positive. And it has added benefits for individuals and communities who live rurally or remotely, who would normally need to travel to access healthcare. Next. And so lastly, low carbon alternatives. So this is about prioritizing treatments and technologies with lower environmental impacts. So pharmaceuticals have a huge carbon footprint and a huge environmental impact in terms of, polluting waterways and all their packaging. And so we need other options. Exercise, diet, and social prescriptions are key examples, and they're like really, really effective when they're instituted and can absolutely remove people's needs for pharmaceuticals by even reversing chronic disease. Next. So one example is the Nature Prescription Trial, which is being run in Adelaide. So within it, there are health professionals, including GPs, psychologists, and other allied health, who give nature prescriptions for activities in green spaces. There are about 60 participants enrolled. It's an 8-week program and includes giving people skills and motivation to connect with nature to improve their well-being. And it will be evaluated, looking to see if participants experience improvements in mental and physical health and well-being. Next. So the overarching message that I'm trying to present is that what is good for the planet is good for human health. And this is all, I guess this infographic just looks at all the co-benefits when we take climate action, how that benefits our health. Mitigating climate change presents unrivaled opportunities for improving public health through several pathways, including those that we've mentioned. So cleaner air, healthier diets, empowered individuals and communities. And so taking meaningful action on climate change is a win-win situation. And actually in the UK health system have a net zero plan, and they modelled that reaching their ambitions under the Paris Climate Change Agreement could see over 5,700 lives saved each year from improved air quality, 38,000 lives saved each year from being more physically active, and more than 100,000 lives saved each year from healthier diets. Next. So that's all I've got. Any questions and discussion?
Thanks, Nicole. That's fantastic. There's so much to think about in that presentation. Given there's only a few of us on the call, less than, I wondered if people did have questions, if they wanted to turn their cameras on and they can ask them directly to Nicole. Does anyone want to go first? Stuart, you're keen.
Hi, Nicole. It's Stuart here. Thanks for the presentation. I suppose I've got two kind of questions, I suppose. So one is you gave a lot of information on the impacts of kind of pollution, and that sort of, it seems to be a major kind of cost that's never included in the business case for renewables against kind of coal-fired or fossil fuels basis. Have you come across any kind of economic sort of arguments or data that you could kind of guide us to? And you don't need to kind of give it to me now, but it would be useful if you've got anything to be able to find that. That would be really good. And then the second component you talked about, the kind of impact of the health sector on with regard to contributing 7% of the kind of carbon emissions to Australia's total kind of carbon kind of budget and stuff. The health sector in Cairns is probably it's the largest economic or sector by economy. I suppose in Cairns it's probably proportionally larger, compared to maybe, and it depends on how the tourism industry kind of plays out, but it would be potentially a very large kind of sector and stuff. Is there anything that we can do to help in that space? And are you aware of the Smart Green Economy initiative being driven by Cairns Regional Council? Because we had a meeting yesterday, and actually the key thing that was in it that wasn't in was around the health sector, and it was talked about yesterday. We're looking for case studies around how do we look at the health sector potentially from a circular economy perspective. So yeah, it's kind of a double-ended question there. So there's probably multiple questions in there, but
No, they're both excellent questions. In terms of the cost, I could definitely research and ask my colleagues in this space if there's any particular numbers that have been done. I guess what we always tend to say is that there's a cost of inaction, and that cost extends, obviously like in lives lost and psychological traumas of floods and other extreme weather events, but also like the impacts on health services, like the increase in ambulance call-outs during heat waves. What we've seen in COVID is that the health system, I guess you'd say maybe it's just managed, but like the overwork, short-staffed, all of that, like COVID's really just a warm-up for climate change, when we think about it. So I can definitely look into the numbers, but yeah, I think that when we think about cost in terms of health and climate, we need to look at what happens if we don't act, because actually the health system in Australia, we're actually incapable of responding to what is going to be the health impacts, and is already. So that's the first question. And then the second question, sorry, you were around case.
Yeah, just around effectively, I suppose, the kind of the impact of the health sector, nationally, and then probably going to be a lot proportionally a bigger impact in our region. And then, what can we do to kind of help the health sector probably end up becoming a more greener health sector? And is there alignment there with the Smart Green Economy?
Yeah,
because I think there is some real potential there.
I've heard of the Smart Green Economy, but I don't know very much about it. So I'd really love to learn more about it.
Yeah.
There is definitely, so the hospital has just started up a sustainability steering committee. This is, it would help to get a little bit more pressure from the outside, perhaps, to push that to go a bit further. I think it's a new thing. The hospital does have a bit of a strategic plan in terms of, I'm not sure you'd say it's decarbonising as such, but, in the way of sustainability and trying to become greener. But it definitely involves a lot more. I think, when we look at the impact of healthcare, like we look at the immediate impacts of healthcare, for example, like plastic pollution. You know, we have so medical plastic waste is huge. But then there's also the issue of so things like when we over investigate as health professionals, like when we're ordering investigations unnecessarily, then that has a huge cost. So it's around training health professionals to think rationally and to use resources sparingly, only as needed. And then there's the impacts, which is the way that we function as a health system is we're very tertiary healthcare focused. So all the money goes into the hospitals. But, you know, I kind of alluded to the fact that hospital care has a huge carbon footprint. And so if we think about somebody with a chronic disease, such as, say, diabetes, if, you know, diabetes for many people is actually reversible if, you know, if we support people to get to a healthy weight, to get enough physical activity, to eat a healthy diet, then actually people can come off their medication and be in remission. But we're not set up as a health system to support that. So the result is that we have people who have diabetes for life, and then all the ensuing complications, which usually involves a number of hospital admissions throughout their life, you know, as well as, you know, consultations with cardiologists and, you know, renal doctors. So the focus on tertiary healthcare is the problem, and we need to shift. It's a mindset of, you know, what does a health system look like? Because really we function as a sick system, not as a health system. And if we functioned as a health system, then there would be more focus on how do we make sure that everyone in our community has access to healthy fresh food, or how do we plan cans so that people can ride their bikes safely, you know, that there's enough shade or there's enough green space, you know, that kids are safe enough that they can spend time outside instead of on screens all day, and then we're stuck with childhood obesity as, you know, an epidemic. So in terms of greening healthcare, I think there's lots of ways to go ahead, but there is talk around a circular economy within healthcare. Yeah, I have heard some colleagues looking at that, and certainly they're looking at it in the UK. So I think there's definitely room for collaboration. And yeah, we can touch base.
And I think that's the thing, isn't it? If we can kind of get, you know, kind of healthcare is also sometimes quite inwardly focused, and it's like, okay, well, how do we help effectively kind of healthcare to look out and then to be connected, because everybody's so busy, kind of focus on patients and that sort of stuff. And it's like, okay, well, you know, that's the opportunity, I think, that Terrain and can kind of help, I suppose, maybe kind of engage kind of a bit more broadly, but it's just obviously getting the right people in the right room at the right time to kind of give the right amount of effort. So happy to maybe just kind of have a chat afterwards about the smart green economy and stuff.
Yep, no, definitely. I think that'd be a really good idea.
That's great. Thank you. Also, Karen, do you want to put your video on and ask this or make this statement and question yourself? It's great.
Hi, everybody.
Hi. Welcome.
Thank you. I just wanted to add to, and I was reflecting on the comments made regarding temperatures, and one of the things that we're seeing obviously through climate change is the change in temperatures is limiting the ability of plants to actually produce their fruit or, you know, their fruit, vegetables, whatever. But clear examples would be like apples, for example, in Queensland, and, you know, corn, once it gets over a certain temperature, you know, it just cannot produce corn cobs. So, you know, we're starting to actually get a reduction in what can be grown and where it can be grown. And that's a direct impact. And obviously the recent floods is a very clear example. And all we need to do is look at our supermarkets and see the impact on that, you know, and the fact that we just simply don't have the fresh produce and therefore people aren't buying it, you know, and that has a very simple direct impact. And the other thing with regard to horticulture and talking about the circular economy, you know, part of one of the things that we've looked at is, you know, reduction of waste. With horticulture, there's a lot of waste. You know, we have a lot produced, but then there's a lack of markets for those second grade, you know, products, and through establishment of advanced manufacturing facilities, we're able to develop nutraceuticals and, you know, other manufactured items out of those vegetables, and that also keeps, I guess, growers going, and Australia being able to produce fresh fruit and vegetables for us. So, you know, it's wide ranging.
Yeah, I would say food insecurity and malnutrition is one of the like really well known, I guess I think I just mentioned once at the beginning, but that's a huge impact of climate change. And like we're starting to see that now in Australia, and you know, in a place where who would think that we'd suffer food insecurity, you know, we're so privileged. But actually it's a real thing. And even the increases in carbon dioxide in the air, my understanding is that it changes nutrients so that food isn't actually as nutritious. And I think, you know, the global food system is a huge, it's a difficult thing, isn't it? Because it causes so many carbon emissions through, you know, lots of agriculture, and then through all the food that's wasted, like you said, because we've developed this psyche where we need something to look a certain way in order to, you know, for us to accept it. And, you know, I think there's lots of like writing out there around local food systems. And I would like, as you're speaking, I just think, you know, this is the stuff for how do we build local community solutions? You know,
that's exactly what we need to do.
Yeah, we need to take charge of it ourselves. You know, I think us becoming sovereign over food is actually a really important thing. But, you know, the flip side is many people are disconnected from their food. You know, classically, like I don't know how to grow anything in the garden, you know, and I buy food which is grown locally. But yeah, lots of people have lost those skills, or they haven't grown up with it in our generation.
We have just recently, well, actually as recent as this week, released a horticulture strategy for Queensland for 10 years as Future Fields. As part of that strategy, there was actually 17 fields identified initially, and that's working across industry, across the state, and getting a whole supply chain input. Those fields were reduced to 4 groups just for simplicity of the timing, and so the 17, it's not like they went away, they're actually just been incorporated into other areas, and those local food solutions were definitely a recognised and a significant part, as well as reduction of waste and you know, in this whole conversation. So you know, the Future Fields report is obtainable, and you can get that through the GrowCon website, and I would suggest having a look at that, because there's actually direct activities goals that will be worked on for the next 2 years. That process incorporated, it wasn't a steering committee, but it was a body that acted like a steering committee, but also a leadership group that were leading those fields and developing the reports for that. So I'm just sharing that information because I realise that a lot of people don't know that that's just happened, because it is very new. But there's a lot of good information in that, and it's a good example of where the industry sees their barriers and opportunities, and it's very relevant to this topic.
Very, and I think also just, you know, a lot of what I see every day is people who don't have healthy diets. And, you know, part of that, it might be a lack of education, or, you know, the way of the world, people don't know what it means to be healthy anymore. But a lot of people actually can't afford to eat, you know, the way that I choose to eat. And when we hear about all this food wastage, you know, the question is, there's a systemic problem here. And I really think local solutions, all that food that is wasted, and, you know, that second grade stuff could actually go to support people's health and, you know, keep people out of hospital, which then reduces carbon, you know, from healthcare.
Yeah, and marketing, we just had Hort Connections, which is the annual event for horticulture nationally in Brisbane. And like, I've just come home from that yesterday, and even talking about marketing, you know, there is a change in trends where in some of the city service stations, rather than having all the junk food up to the counter, we're starting to see, you know, fruit and vegetables packaged, you know, for easy access as a healthy alternative. And I think that's part of the messaging that we need to actually put out there as well.
Yep. Thank you.
Thank you.
Thanks, Karen. That's really great. This just shows how good it is to get people from different sectors together to talk about these issues, because there's so many things that we can do better together, as we were talking about, those sort of local community solutions. Does anyone else have any questions? Otherwise, we might wrap it up. Oh, here we go. Here's one from Tia. Do you want to ask it yourself, Tia?
Sure. Oh, yeah.
Hi.
Hi,
Hello.
Nicole. So my question, I had a few questions, but you pretty much answered them. But I was wanting to go more back to like the clinical perspective, like what alternative and sustainable methods will we be looking at on clinical sharps waste bins? Because I know, like, as like you did briefly mention that it, like the medical sector is like a huge like area where we do a lot of like waste and like polluting in our oceans and stuff with like sharps and like even wearing masks and like other plastics, and just wanted to see if they like, or if the hospitals have come up with alternatives of disposing these sharp goods more appropriately, that's more sustainable.
Yeah, there is, I don't know it in detail, but there is work in this space. So the Centre for Sustainable Healthcare, the graph that I showed before, they actually have a course on how to make your practice more sustainable. And one of the things they talk about is circular economy stuff. I think there's an initiative, I can't remember, but there was like something which we typically throw in the waste, and it was all being recycled into something else, and I can't remember, but there is a concept of a circular economy. Like there's been some work on it in the health sector. It's just not widely instituted. And I would also say with this, like for example, clinical waste, so the waste that goes in the yellow bins, most of the stuff that ends up in those yellow bins doesn't need to be. And so a lot of health professionals aren't educated on what goes where, and that's one of the problems. So actually there's more stuff that could be recycled. And I guess the problem, like the issues are, number one, we're not educated on what goes where, and we're usually really poorly compliant as well. It's really hard to get health professionals, particularly doctors, to follow, instructions like put this in recycling and put this in somewhere else. And then the other thing is that we're so over-resourced in Australia, and everyone is in such a rush that we don't think about what we don't need. And so I guess an example, like something that I just do in my practice, like putting in Implanon. So in contraceptive implants, we always get, or I guess the protocol, the sort of guideline is to get out a dressing pack and, to get out these sort of gloves and this and that. And once we open the dressing pack, I think I use about like 3 items out of that, and the rest goes in the bin, which is just drives me nuts. And so I just make a habit of just getting the few things that I need, and I don't use a dressing pack. And, it probably doesn't make any difference in the bigger scheme of things. But to me, it just speaks to the fact that in healthcare, we just do things like most health professionals aren't thinking about the waste that we're creating. And, this is probably, it extends to all sectors, really extends to when we go shopping in Woolworths. But I think, that's a bigger thing, is how do we all slow down and really start understanding that every bit of waste we create ends up somewhere. Every coffee cup, disposable coffee cup, ends up somewhere. It doesn't just disappear into the ether. And, we really need a huge shift in health. And health is particularly challenging because, as it's been mentioned, we're very narrow focused, and, we want to fix the patient in front of us. And we forget that actually all these other impacts from our practice is also impacting the patient's health. So yes, there is stuff happening, and I can find it and send it to you. But it needs to be instituted widely.
Yeah, because I was also just thinking too, now that you were talking, like it's kind of like a contradiction, because like you want to be there to help the patient and be there for them, but there's also like regulations from a health perspective, a medical perspective, where it's mandatory to wear gloves, or it's mandatory to wear masks and like other health procedures. And it's like, well, how do I reduce using these like materials and stuff, but in saying that I have to protect myself? No,
100%. And we still overuse, like there can, for GPs, for example, some colleagues I have who, try to practice very greenly, and they've, kind of looked at greening their practice. They save so much. Like there are lots of, like, I don't need a sterile gloves to put in a contraceptive implant when I'm not touching anything. It's so easy. There's no need to have those sterile gloves. And so I guess that's another thing. It really requires working out the same with like biological waste, like what is actually needs to go in the yellow bin. I think it's like 10% of what ends up in there needs to be there, or something ridiculous like that. Yeah.
Okay. Oh, cool. Thank you.
Sorry.
Thank you, Tia. There's so much to think about, Nicole. You've
It's a bit overwhelming,
for a
isn't it?
Friday afternoon, there's so much food for thought. I think we'll wrap it up there if that's okay. And
Yes.
perhaps if you could stay on the line for a minute and you can chat more with Stuart about the smart green economy, that would be great. And thank you to everyone for coming along, and we'll see you next time in July for the other climate webinar about community power. Thanks.
And could
Thanks.
I ask, is Karen able to stay on too? I was just looking at their GrowCom strategy and stuff as well.
Yeah, sure.